Jai Predictive.
Hey, predictive, sir.
Today is the 7th session of differentiation of the different remedy by Dr. Dharmesh SAVAJ. We have seen the wonderfully exactness, replica and reflection of the what Dr. Prapul Vijayakar was saying about the predictive homeopathy's thought process in different materia medica, drug in a tri-miasmatic and clinically, and how to perceive. Today is the 8th February and it is the day of the moon reflection. You will see the moon, an exact reflection of the another side, another big moon, which is similar to that things. So we have seen exact similarity and exact replica and reflection of the knowledge of the predictive homeopathy by Dharmesh SAVAJ. We are really appreciate, and I welcome to Dr. Dharmesh SAVAJ.
થેન્ક યુ જીતુભાઈ. પાછું તમારે આવવું પડશે થોડુંક. We are continue with our session. We are 7th session. We just completed the Ophidias, a different remedy from snake, prepared from snake poison. Some rare snake. We'll discuss a few points later by Dr. Jitesh. And we are continue with our session. So we just completed Ophidias and we have also completed Medorinum, the side by side similarity with different Ophidias, the different analogues, and we again move ahead to the another remedy, that is Spongia. It is said to be a vegetable lachesis. We completed Ophidias. In continuation with we completed Medorinum, and when we think of Ophidia and the sideline of other remedy which is identical to the snake remedy, one of the is Spongias, other is Drosera. Then if you have a case like psychosomatic disorder, a hysterical patient, or if the patient is hypochondriacal, not improve with the lachesis. So one of the remedy, one of the hysterical remedy which is lachesis like is simicifuga. One may think of simicifuga, right? And when we have respiratory disorders, means have lung pathologies, and lachesis will not improve, a modality like lachesis is Grindelia. So we have to remember some more remedies which has a snake-like affinities, and when you have not in cure process with the Ophidia, think of the remedy like. So one of the remedies Spongia. Why it is? Because it has some modality like this and some perception like Ophidias. So I have taken this. Mournful past, constant fright, and the reaction is pursued, persecuted and tormented. Right? एक beautiful delusion है Spongia का. Delusion, persecuted, that he is tormented by some frightful scene of some mournful event of the past. So past में कुछ ऐसी घटनाएं हैं जो दुखद है, काफी दुखद है और काफी डरावनी है. उस कंडीशन में से पेशेंट बाहर ही नहीं आ रहा है. सो हम पेशेंट को पूछते हैं व्हाट इज द प्रॉब्लम. तो सर तकलीफ है, सफरिंग है. पूछते क्या है, तो दिस कुड बी अ सिचुएशन. इन साइकियाट्री सर वी हैव PTSD, post traumatic stress disorder, right? So in that situation, this could be the one of the perception person might have, right? Delusion, persecuted, that he is tormented by some frightful scene of some mournful event of the past. Means patient को कुछ abuse हुआ है और some event ऐसी हुई है, like कुछ death हुई है. उस situation से, उस stressful situation से patient बाहर ही नहीं आ रहा है. So that thoughts is continuously tormenting, उसका पीछा नहीं छोड़ रही है, उसको हैरान परेशान कर रही है. Person cannot leave off that thoughts. So one can think of Spongias. Like people have a lady have abortion, repeated abortion. That is also a very mournful event, right? Repeated death in the history of rape, right? Molestations. Person cannot coming out of this. So one may think of the only remedy given is spongia, right? And delusion pursued also same thing. उससे बाहर नहीं निकल रही है, उसका पीछा नहीं छोड़ रही है, right? Think of spongia. Could be any pathology. When we have this perception, think of. Very important remedy for croup. We all know. Very notorious dry cough, unbending cough, harassing cough, persistent cough, whooping cough, croup. Sleep is like legacy. That's why I put in the sideline of ophidia. Sleep is like legacy. How it is. So, awaken, frightened with suffocative attacks, anxiety, valvular insufficiency. So it has a deep affinity for cardiac. Valvular insufficiency. When we have pathological case and the perception like this, the symptom like this, you can think of goiter, gasping respiration. इन लोगों का ये रहता है जैसे मैं सोने जाऊंगी, I got an attack, I don't have the breathing, the inspiration could be anything, I have suffocative attacks, lot of fears, lot of distresses. So the night is very tormenting for this type of fever. We know that ophidia has sleep into aggravation, aggravation into sleep. These people also have, right? So I put into the differentiation, you can think of spongia in that case, right? So it's a combination of modality of ophidias, perception also like that of ophidias, suffocative attacks, with the glandular affection, with cardiac pathology, right? So mournful is a sadness, a kind of the expression of sadness, right? And the sadness comes from where the person cannot register the love, right? The sufferings. So it directly come into the cardiac. So when we have cardiac affections, one of the perception is disappointment or deception in love. So you can get this type of perception, you can think of with cardiac pathology, with glandular affection, you can think of. Other remedies which have the perception like persecuted, tormented, harassed, we have many prescriptions. I think majority of prescription, maximum prescription done by Jitesh bhai about the spongia, right? Another remedy which is Drosera. One more remedy is Ruta. The other one is China, where we can think of when person has a persecuted or torment like affections. We have feel કે ભાઈ કેટલું ત્રાસમાં છે, તકલીફમાં છે, હેરાન પરેશાન કરી મૂકેલા છે, લોકો હેરાન કરે છે, લોકો પરેશાન કરે છે, right? So we can think of, but the different remedy have is different perception, because miasmatically આપણે જોઈએ તો each remedy has its own sora and each remedy has its own syphilitic reaction, right? So lysine also has a persecuted, like tormented, but each has its own differentiation. When we think of Ruta and Drosera, Drosera is an insect feeding plant, right? So the persecution or the deceived or pursued or torment coming from the survival issue, right? कुछ भी करके मुझे खाना है, जिंदा रहने के लिए मुझे खाना है. So when the insect comes, all the trapping mechanism and all the things happens, then they digest the insect. And so when somebody ditch me or somebody disappoint or deception me, means betrayal type of feelings, person immediately land up in the, we have delusion, right? Delusion, deceived being, right? उसमें रूटा एंड ड्रोसेरा है. So उसको यही लगता है कि people मेरा ट्रस्ट का यूज कर रहे हैं. I mean deceived, I mean betrayal, right? I cannot trust anybody. उसको ये delusion है. So from this perception they are going, right? Ruta we think in the affinity we have lameness, stiffness, restricted movement, less joint. So Ruta, after being hurt or after being deceived, they stuck up at some point कि भाई इससे मैं बाहर नहीं निकल रही हूँ. While Drosera people, they are very intelligent, they execute, वो निकल जाते हैं. ये difference है, right? China, we have China में paroxysm क्या है? Malaria. So suddenly the whole day is very good. Suddenly the paroxysm comes. The whole day is good. Suddenly the paroxysm comes, right? So it is actually a frustration, right? कि भाई कुछ भी नहीं है. Why this thing happening to me? Unfortunate type. वहाँ से उसका जो भी perception है, persecuted है, torment निकलता है. And it is actually seen in the body also, the face also, right? So persecuted and pursued perception, torment perception, we have to think these types of remedy. There are many cases of multi-drug resistance, COX, yes sir, prescribed, even blindly prescribed Drosera આવી ગઈ હોય sir ને. Perception comes later and it is exactly matching to the pathology. Recently last night also we discussed surrounded by enemy, generally there, this is the only remedy, Drosera, right? So જ્યારે આવી perceptions આવે, means persecuted, torment, we have to think like these remedies. Why this perception? Why this person is thinking like that? What is the behind sensitivity? Why is reacting like that? So we reach to the exact core of that remedy and then we have to prescribe, right? So with nearby we have, with the nearby ophidia we discuss medorinum, we discuss China, we discuss Simicifuga, we discuss Spongia, we discuss Ruta, we discuss Drosera, right? We discuss medorinum and we move ahead. Apis looking like, again looking like ophidias, have a component of the animal kingdom, the poison, the endotoxins, the jealousy part, the suspicious part, right? The vindictive approach, looking like, but it is different. Apis here as a trait, this is a trait, red line is a trait which is running throughout the life of this type of people. They are manager, they are highly skillful in management, Apis. When you think of Apis, when you have the patient, they are very efficient in the management part. They are highly efficient because the intellect, the speed, the drive to do something makes them highly efficient for management, right? And sometimes we think Apis, you remember busy as a bee, right? They are busy, whatever, busy fruitlessly, restlessness, industrious mania for, all rubric comes in the Apis. So impulse to do something, this is the Apis, right? वो हमेशा busy रहते हैं to collecting the honey for survival, right? So they generally hot. Sir has put up in this axis dull hot firstly. Expression is also haughty, dominating like lycopodium. Also timid, but the inner aggression is there, right? In acutes we have the edema part, and the sir has put in the urinary symptoms. They have a territorial, always have a territorial issues, right? Like acute UTI, repeated UTI, stones, and many cases, urethritis, you can think of. Anger dominating, they dominate the physician. It's the only reason. They dominate the physician. By doctor मैं हूँ कि तू है, right? So they have very controlling attitudes by their complaints, by their arguments, and by their questions, right? Angry, dominating, jealous. What is the difference between the jealousy and suspicious part of HAPPHYs and LACEs? Both runs parallel. Sir, HAPPHYs है कि LACEs है? Suspicious है, jealousy है, right? Here, the suspicious and jealousy comes from possessiveness. Mind well, remember. HAPPHYs is everything is coming from possessiveness. There is an inner discontent. मुझे honey चाहिए, 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 चाहिए. So possessiveness makes the HAPPHYs more in prescription, while superiority runs in the animal, but the anyhow I has to win this war, right? This is lachesis. मुझे कुछ भी करके ये जीतना है, right? मुझे आगे ही जाना है. So that makes them very jealous, suspicious and all, right? So more the possessive, more the HAPPHYs, more the superiority and inferiority and complexes, then everything comes vindictive and malicious, everything will come. But the possessiveness is this HAPPHYs. Sadness, indifferent, stuporous, sometimes it looks sepia also, right? But the intellect part and the speed is very fast in HAPPHYs, right? Sepia is almost frustrated, nothing is interesting, right? Chilly, here HAPPHYs is hot. Edematous face, especially eyelids with frequency of urine increase but scanty urine. Edematous face, right? You see many insects have these very big eyeballs, right? Very lean thin body, but the face suggests something different. So this is a distortion part of these types of kingdom, insects, right? Edematous face, we have the symptoms, upper eyelid and lower eyelids, bag-like swelling, right? Loss of speech or inability to talk, very important concomitant even in critical cases, aphasia with the fevers, right? So when the bite comes, it immediately, the endotoxin immediately goes into the blood, the immediate sepsis, the immediate critical condition happens, right? So when we have sorosyphilitic condition, it is also insect bite. We have the symptoms, elements from insect bite. Does not complain. They are not complaining many times because their inner frustration, inner discontent. Why should I talk to you? That is also a haughty part, not the indifference but the haughty part. Why should I discuss to you? Right? Unless and until you discuss, we have discussed, right? But I cannot discuss to you. You just give me the remedy. Shrieking in sleep. This is also concomitant. So when we have symptoms constantly found out with the chief complaint, we have to look. Is in acute as well as in chronic. When if it is a syphilitic, it is definitely important, right? Burning and transparent bag-like swelling, jealousy we discussed, busy fruitlessly, more of right-sided, complaint comes from right to left, right? Warm-blooded, no thrust, pathologies like honeycomb. When you have honeycomb-like pathologies, ILDs, some part of cirrhosis, when honeycombing happens because of thinning of interstitial tissues, one of the remedies is HAPPHYs. Okay. Same like pulsatilla, changeability લાગે આપણને કે ભાઈ manipulate કરે છે. But the emotional part, when they use the affection for survival, means emotional blackmailing જે હોય, that is pulsatilla, and intellectual manipulating and blackmailing, that is ophidia and daring to, right? Because the pulsatilla want the affection, right? That's why they just go, they use the affection, whatever, consolation, piteous crying, whatever, but everything this coming from the selfish affection, right? And ophidia, they want to win the battle, they want to have comfort in their territories, they have a fear from attack from behind, so that makes them very agile, very intellectual, and they manipulate the things. We had discussed the manipulation part in the ophidia slides, how they deceive, how they use the bites, how they use the poison. So this is the manipulation part of Ophidia. So you can think of pulsatilla as well as Ophidia when person is manipulating. लगता है कि घुमा रहा है, झूठ बोल रहा है. You can find a different history from different perspective, different family member. The history is not matching, means कुछ तो गड़बड़ है, right? And the all acute parts, right? Dry mouth, yet no thrust. This is very important disorder control of the hypothalamus. Every time we find complete trustlessness, like Nux moschatas and many other remedies, changeabilities. You can find changeability is as a defense. It is not only the psychotic changeabilities, right? It could be a syphilitic changeabilities. Means person change up to that extent that destroy their life. कि भाई जिंदगी बदलने 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 में इतनी ये अंदर घुस गई कि लाइफ बर्बाद हो रही है, right? Means suppose person clinging to some mafias, the drug like, कि भाई घर से प्यार नहीं मिल रहा है तो just go to the friend who are drug addict and they have their own changed life. So this is also a changeabilities. Wife says that sir पूरा बदल गया है. So what is that changeabilities? So that changeabilities is coming out of affection and they just become drug addict and they just destroy the life. So वो change करने में उसने autoimmunity create कर दी, अपने आप को मार रहा है. So this is a syphilitic changeabilities. We have changeable genes also, we have changeable paroxysm also, we have changeable pattern of fever also, we have changeable symptoms of reaction also, we have the emotions, behavior, everywhere. When you find the changeabilities and the sora is love and the support, you can think of pulsatilla first, right? Involuntary mourning with fever. You have taken, na?
Yes.
Mourning with fever, right? But we are not prescribed pulsatilla, right?
Yes.
There are 20 remedies. Mourning, this mourning, kakalu, takleef che. This mourning is coming from irritation, the anger part. And anguish, which is coming from the fright and fear part, right? So once mourning is a part of sorrow-syphilitic when we have complete crying, right? એવું કકળતું હોય તો આપણને દયા આવી જાય કે ભાઈ આનું કંઈક કરું. That is the affection part of in acutes. Sir has mentioned in acutes, right? Involuntary mourning with fever. Elements from rich food, heavy foods, very common nowadays. Junk foods, right? It has also clinging because they are weak will. They want support, right? What I suggest clinging, what I have discussed, clinging. So clinging attached to the person who destroy the life. It could be anything. It could be a spiritualism, it could be a drug addiction, it could be a companion who is destroying these families or, right? It could be any syphilitic relation where person clings to and destroy the life. So this is a syphilitic clinging. You have to think of many other remedies we have, phosphorus, bismuth, borax, right? But why person clings is very important. So when you study the ODP of this pulsatilla, you can get why the person is clinging, right? Suspicious, selfish, deceitful, like Ophidians and territorial. So it is exactly looking like this, but they are very in the affections. Immediately they cry up, immediately they change the emotions, right? Makes the prescription of pulsatilla. This is a disposition where you can enter through, we know everything. Fat rich food, yellow discharges, green discharges, predominantly psychotic, so easily going into psychosyphilitic, right? Want attentions and consolations, highly emotions. So they are moved from which brain? We discussed in the brain dominance. The person is moving from this to this, right? So when the person uses the emotions coming from mother brain, right brain, right? Make the person left-sided. So pulsatilla is left sided, right? While the ophidias, right? They use the left brain because they are intellectual predominant. So the intellect part, the knowledge part comes on the left brain. So most of they are right sided except lachesis, right? In differentiation we have mineral pulsatilla, kali sulf, kali mu. Later we discuss kali sulf. Vegetable pulsatilla, cyclamen, metallic pulsatilla. They are complementary, they share the complementary relationship. Metallic pulsatilla is sternum, right? Timid, sensitive, weakness, emotions, better by consolation, all sternum has. But sternum has one particular sensitivity of staphysagrial light. What people will say, sensitive to opinions of, right? Pulsatilla is bit confused, while sternum has metallic quality, so they have an intellect part, right? Vegetable like pulsatilla is cyclamen. Cyclamen, sir has put in the highly moralistic, responsible, diligent, conscientious remedy. So when you have the pulsatilla like case and autoimmunity, person is diligent, conscientious, you can think of cyclamen, most autoimmune, sensitive but practical pulsatilla, like aurum, right? So they are practically looking like pulsatilla. So they are a combination of pulsatilla as well as aurum. But aurum has that sensitivity is missing, right? Metals generally are less sensitive. Metals are generally less emotions. They are more practical. They are not easily attached, right? Very rich food, fat foods, mumps, metastasis to mammary and testis, the cancer, very important pathological point, how the person is transforming the virus. So when the mumps goes to the testicular things or any glandular deeper structure, you can think of very important concomitant. Great dryness without first, sleep. First sleep restless, sound asleep when it is comes to get up, awaken languid, unrefreshed, reverse of nux omega. Most of the common we find this sleep cycle disturbed. Nowadays are very common because sometimes have a 15 days labor have 15 days shift night, then 15 days shift day, then night and day. So this disturb the this melatonin cycle, right? It disturb this and it disturb the circadian rhythm. Sir, अभी इसका कुछ नहीं कर सकते. You have something to have balance in this melatonin cycle to reverse this process, because sometimes this sleeplessness is a big headache. Sir, इस नींद का कुछ करो. So pulsatilla has these types of attributes. Reverse is nux omega. Remember, both that control and balance the circadian rhythm, right? Verse lying on left, on penless side we have modality when allowing fits to hanging down. So it has vipera like pathology also, allowing the fits to hang down. जो भी संचय पे है, those who are putting their constant leg down and produce venous pathology. It has also varicose vein, varicose ulcers, peripheral vascular disease. Pulsatilla also covered. Pulsatilla, silica, fluoric acid. We have trio share the complementary relationship. When you find pulsatilla is working to some extent, person change into the silica-like feature, changing into the fluoric acid-like feature. We have to think like that in differentiation. बहुत दूर नहीं जाना है, नजदीकी रहना है, because it has a affinity, it has a relation, it has a complementary share. So you will solve the case in that point also. Never well since puberty. Very big element nowadays. Many young girls stuck up at puberty because of the identity issues, lot of dominations, lot of the notorious pills and whatnot. Elements never since puberty land up in post-marriage infertility, stuck up at menarche. Very important hormonal remedies said to be a progesterone. Pulsatilla is poisoning with who have taken much iron, quinine and tonics. I purposefully this because sometimes iron drip is very notorious. Person can end up in anaphylactic like reaction. So pulsatilla is one of the remedy where you have such element, because these are sensitive, right? Even years before, still reaction is anemia. After a repeated tonic also, still person will end up in anemia. You can think of pulsatilla. Pain which is drawing, tearing, erratic, rapidly shifting. So again the changeability comes, right? So it is constantly throughout. The other remedies we have Kalibai, Leccan, Manganum. Pain with chilliness, very important. सर जब भी उसको दर्द है उसको ठंड आती है. सर जब भी उसको दर्द है ठंड आती है. Very important concomitant. Pulsatilla. Prodrome means उसका क्या है? The expressions of symptoms क्या है? This has Boger mentioned कि भाई what has happened, पूछते क्या हो रहा है उसके साथ. So the symptom is like changeable, shifting, appear suddenly or leave gradually, or tension much increase until the very acute, then lets up with snap on first motion going to the part layer. So you cannot define which direction it is going. So it is purely a hysterical reaction. So very important reaction sir has put. A 7 syphilis is one of the reaction is hysteria. So it is one of the hysterical remedy. Like Mosters, Valeriana, Sinicifuga, right? Where there is a haphazard expressions. कहाँ पे क्या होगा, कैसे होगा, किस तरह express करेगा, nothing will, nobody will say, right? कभी fever 2 घंटे पे आएगा, कभी 24 घंटे पे कुछ नहीं होगा, फिर 4 घंटे पे 4 बार आ जाएगा. So this is erratic. We have rubric erratic fever, erratic. So this is hysterical reaction. There is no control over the hypothalamus. Temperature regulating mechanism, and person has this. So this is the expression of changeability. I try to combine this all and just try to narrating it. You remember how the expression in syphilis, how the expression of changeability in psychosis, and because they are soft, they are cannot able to defend. Soft plant, na? Internal, external heats with the veins are distended, sleeplessness, chilliness, restlessness, urine emitted with cough. They don't have the control, right? So there's sir, इतनी खांसी आ रही है कि I got just urination, right? One of the remedy. Desire for tonics, sir कुछ tonics दे दो. So they want constant support. That powers that energize the constitution. Because they are internally timid and fragile. So जो भी fragile रहेंगे, timid रहेंगे, they want tonics and all IV drips and all these things. Prosoplegia toward evening till midnight. So this is one of the remedy. We have neuralgias, chilly with the pains, hearing difficult as if the ear were stuffed, otalgia worse at night. I think only remedy have middle ear otalgia at left side in repertory, right? Sometimes this at night, worse at night, everybody is sleeping, these people are crying. So sometimes we can't find the exact modality, what to prescribe, what not to. The baby is also continuously crying, you can prescribe otalgia worse at night, pulsatilla. Okay. I think we discussed very earlier lecture, how can we come to the triamiasmatic view, syphilitic, psychotic and SORA in the differentiation of aurum and pulsatilla. Aurum is throughout strong, pulsatilla is looking like strong but they are not strong, and from that point we can differentiate the remedy by studying the ODP, the genesis, right? Why this? This is a point when consolation amyloid that makes the pulsatilla psychotic. And we go back to SORA and how the syphilitic reaction, we combined all and we have triamiasmatic view we discussed that helps in the differentiation. So this key point is helping in differentiation, right? We discuss all how it is. Tuja, in the axis line, these remedies are coming: dull, hot, flushless, So I put into the good image and cautious. These people are very cautious. We all know why Puja is cautious. Because the inner fragility of mind, right? Acutes, we have diligent, cautious elements from vaccination. Nowadays, very common element from vaccination. Somebody has the death prank to promote the cervical cancer vaccination nowadays, right? Death prank. So this endotoxin goes to weaken this type of constitution because these people are very sensitive to it, right? Delicate but fat, stouty children, cautious, afraid to walk and move, jump, fragile sensation they have. This fragility expressed, we have discussed in somewhere. This fragility expressed, how it is expressed at cellular level, at genetic level, at bone marrow level, at perception level, at mother perception. We discussed how this fragility runs and body defense, right? Crankiness have particular time modality. Some author has given, so I put it. Vaccination, antimatter, silica. Now the differentiation is when person is vaccinated and how we react, that gives us the remedy, right? Silica has the abscess and the weakness, the connective tissue disorder. Antimatter has more of lung affinity, brain affinity, neuralgias. Puja has bone pathology, some soft tissues, right? Tumors, psychotic growth, right? History of recurrent UTI, psychotic growth in pelvis that is suppressed, medorinum and Puja, because they said to be a king of psychosis, right? So when you narrate and want to confirm the Thuja, there is a history always. UTI and psychotic growth in the pelvis, and that got suppressed. Always that got suppressed. Makes the description Thuja. Now this cautious, they are cautious as a reaction. Every time पूछते हैं सर क्या रिपोर्ट कराए, क्या कुछ आपको लगता है? They are just coming in the times. They are very particular to the foods. भी लगता है इनको काफी सचेत है. So how this is coming? We know that they have a delusion, the altered perception of fragility, right? Delusion, fragile he is. Means I think that I am weak and my weakness should not be exposed because they are psychotic. Their weakness should be not exposed. That makes the person fragile. So this is the core of that. Why person is fragile also, right? So जो भी security है, जो भी stability है, उसको पकड़ने की कोशिश करेंगे. We think that person is cautious. Why person is cautious? Because of fragility. What is that fragility in life? तो उसकी fragility life में ये है कि my weakness should not be exposed, right? It could be any level, children level कि भाई मैंने गलती किया है क्लास में, I should not supposed to tell my mom. Politician है, my dictums or my anything could not be exposed, right? Or the girls has my negative should not be exposed in the family. So it could be any weakness. Could be think of Puja. Psychosis is ugly and moving feeling inside. So everything is manufactured in this world. So that's why they said to be a king of psychosis. Everything is so facade, everything is so fragmented, everything is so manufactured. You can't get the right picture because of psychosis. Those who are psychotic remedy, you have to fragment the history from behind, from the family member, from the friends, or anything from the reports. You can't pick up these people because they are highly psychotic. Fixed ideas, fixed ideas. कुछ एक ही point पे अटके रहेंगे. Dull, hot, trustless, the point differentiation, where many common expressions, hot, dull, hot, trustless. Many times we stuck up in the acutes. So I make some differentiation, very easily differentiation when you can make out in the acute cases where this axis is there, dull, hot, trustless, and when we have these remedies. Pulsatilla, we know that consolation, desire, especially motherly consolation. If the father is also giving motherly consolation, is also pulsatilla. Father is giving mother-like consolation to the baby because the baby want mother type affection, pulsadilla. Carboage, because of have a lot of disintegration with O2 and CO2s, right? They have a ischemias, they have a hypoxia always, they have always a hair hunger. So that air hunger makes them want fanning continuously. So in acutes, they have air in motion desire. So here desire is consolation, here the desire air in motion. They want always, because of they have air hunger. Lipo desire knowledge, right? क्या करती है, क्या पसंद है? So somebody want the affection, somebody want some physical transit, somebody want knowledge. Brahmanya wants money, rest, absolute rest. So that makes the clear-cut differentiation in acutes, right? Brahmanya desire money, absolute rest, कुछ नहीं करेंगे. सर आज मैं आराम कर लेता हूँ, कल मुझे कुछ भी करके जाना ही जाना है, आप कुछ कर दो. So they are more of monies and works, ethics and business and calculation, all these things. Makes the Brahmanya. In acutes only, huh? You cannot every time find these modalities in, or it will not help in the pathological cases. Nail deformed and brittle. You can find, when you check the nail, you can prescribe graphites, antimcrude, silica and thuja. Most have deformed and brittle nails, right? जैसे ही डेवलप होते हैं just deformed. So this is a defense of that constitution. Hydrogenated constitution. Always have a fluid inside the body, right? It could be anything. Pleural effusion, lot of watery cough, ascites, edema. They have a hydrogenates, right? Every time has to tap and tap and tap. So this makes why? Because this fluid comes as a security or as a supportive element to protect the organs, right? That's why these people have this type of attributes. Must remember, this is psychotic, but why these people using these attributes is very important, right? Somebody use suppurations as a defense, somebody use cracks. So these people use water as an element to support the organ. That's why they have a hydrogenated constitution. You check the nail, you check the teeth, you tap the abdomen, you can find the pathologies. Teeth decay at the roots, crowns remain sounds, right? We have modalities, measuring on the edge, staph, crumble, turn yellow, cephalinum. So once you clearly observe the teeth, you can also prescribe when nothing can be found, right? Because the body never lies, body is always exposed, right? And they defend through this body only. So when you cannot catch the mind, you can catch the body, and you have a clear-cut fine descriptions. They have a roots decay, right? Children we have very common nowadays because of these poor immunities, lot of vaccines, lot of antibiotics. They destroys the roots. Puja is one of them. Anus fissures, they are all psychotic pathologies, right? Nears the pelvis, nears the openings, warts and all, piles and all, whatever. But puja like constitution you can prescribe. Flesh feels as if bitten from the bones. Many cases of chikungunya, post-viral, post-dengue, this patient will say, right? सर किसी ने मारा है, किसी ने इतना मारा है, ऐसा लग रहा है कि पूरा फट रहा है, बहुत दुख रहा है, right? Phytoleka, because that this have these affinities, right? I think bone marrow complaints, thuja is there. Thuja is there in bone marrow complaints. As if scrap is rustox, सब घिसा हुआ है सर, पूरा घिस गया ऐसा लगता है, आवाज आ रही है और बहुत पेन है. So you can make out this sense, but this sensation has to be continuous. It has to be a progressive. It has to be individual element of this constitution. Not only it could be a common symptom, but you have to check the intensity. How it intend. It disturb the routine quality of life, routine work. Then it is important, right? It is not a simple arthritis. Natramure most often prescribed. Remedies, sometimes also misunderstood with many elements like magnesium, calcarea, sepia, all. Their core feature is harmony. We know that they want to balance the relationship. How it is, we just go deeper into it. Dull, hot, firstly in acute axis, non-diligent, sir has put into the non-diligent, non-conscientious people, sun aggravation, visitor aggravation, aorta, all these things are there in netrums, right? Silent, quiet aversion to guest, sir has उसको गेस्ट आते हैं पूछते हैं अच्छा नहीं लगता है acutes especially have aorta, lot of angers, but this expression is coming out of hurt. The anger, the all morose is coming out of hurt. उसको कुछ लगा है, like they are very sensitive people. तो किसी ने कुछ बोला है, they just silent up. They don't want to share their hurts and all these things. So that's why they are looking morose and all these things. Anger when oblique to answer, right? Face से पता चलेगा, right? Aorta of the China is different. The aorta of Colosseum, Darsenic is different. इसके face में हमको लगेगा कि कुछ दुख है, कुछ hurt है, right? The body is telling something, the mind is telling something, the face is also telling something. So you cannot match that things. Once you match these things, you have a prescription of netrum mu. How it is, we can see in the later slide. These are loneliness, we have the vomiting with fever, carousel, lower lip, scaly, cracked. So this lip signifies the love, right? They have always cracked in midlines. So they have always in discords, they always have in the cracks in the middle, means their harmony is always destroyed. So that makes the people, why this they are looking for the harmony, why they are looking for the one-to-one relationship, why they are looking in balance into the relationship, because their sensitivity is like that. How it is, we see later on. Because they are very sensitive to criticism, they are very sensitive to discord, they are very sensitive to reproaches, even rudeness also. They are very sensitive, right? मैं भी hurt नहीं होना चाहती हूँ, मुझे hurt किसी को करना भी नहीं है. I don't want to share my hurt to anybody. So this is quite difficult part of netrum, makes them very introvert. So they have always lower lip, scaly, cracked in middle, even in acutes also. Many children you to find this. Absolute problem of central axis. 3 to 4 cases of vitiligo. I have 3 to 4 cases where netrum mu single dose help. Almost entirely 70 to 80% cure is there. Right? Netrum mu central axis. When the spot comes to the central axis, उसका first spot रहेगा chest, in the middle of the chest, right? Exact. So this is a central axis. This is loved one. This is family, near and dear one. They hurt. They are preached. They have a lot of disappointment, lot of deception, lot of setbacks, lot of hitbacks, and they want to connect, and then at the end they just destroy their life. Love to somebody else, or indifference, or forsaken, whatever feeling is coming, develop vitiligo or axis, central axis problem. So very important. Reaction, grief, always. So netrum is in a group of sadness. We have the different trait reactions in the later slide. So that netrum is there. So what is the grief? So grief as let's suffer in silence, yet sensitive to hurts and rejections. So मुझे मेरा जो दुख है वो मुझे ही सहन करना है. I don't want to hurt anybody. If I say something, I also again I hurt. So that sensitivity to hurts and rejection makes the netrum like this, right? We have rubrics recently I taken. Sadness cannot console. वो ओल्ड मैन को उसको सिवियर लंबर स्पॉन्डिलोसिस था और बेड रिडन था. You want to support with the other hand, and he is in from Rajasthan, so the history cannot get it, but the expression of tells everything. I got a bit disposition कि भाई ये चाचा बहुत बोलते नहीं है, काफ़ी सेंसिटिव है, लेकिन the expression is there is a severe lumbar spondylosis, means कुछ तो painful situation है, which is very painful situation. First is painful situation. Second, there is complete paralysis, cannot moving, want the support. So paralysis condition वाली भी है. So ऐसी condition जहाँ पे helplessness है और जहाँ पे pain है. So life में ऐसी conditions आ रही है जहाँ पे बहुत पेन है, लाइक बैक है तो किसी ने सेट बैक पे कुछ बैक हैज मींस बिहाइंड, सो दिस इज वेरी अफेक्शनेट एंड वेरी सेंसिटिव पेशेंट. सो कमिंग फ्रॉम लव आई गॉट सैडनेस कि भाई ये दुख है, दे हैव कॉन्फ्लिक्ट विद द ब्रदर. सो फ्रॉम सैडनेस आई एंटर कैन नॉट कंसोल कि भाई ने बोल दिया आपको जो करना है वो कर लो, तो दिस फेलो हैज डन नथिंग. They just suppress all his emotions inside, and that cannot be consoled कि भाई अभी ये जो दुख है, जो भी मुझे करना है फैमिली के लिए वो मुझे ही सहन करना है. There is no way out of it. So I taken the rubric sadness cannot console. Arsenic Naxomica natron mute. So it's prescribed natron mute was improved. Constant brooding can be a delirium. Means सर ये thoughts का कुछ करोगे, many times discussed, right? सर ये कुछ जा ही नहीं रहा है, इतने थॉट्स आ रहे हैं मेरे को, आई कैन नॉट गेट रिड आउट ऑफ इट, विच इज आउट ऑफ कंट्रोल. डेलीरियम ब्रूडिंग नहीं मिलेगा हमको. सो वंस अ पर्सन रिएक्ट एज अ कांस्टेंट ब्रूडिंग, सर पूरा दिन बैठी रहती है ऐसे ही, राइट? सो दिस ब्रूडिंग कम्स एज अ रिएक्शन, यू कैन थिंक ऑफ ओवर सेंसिटिव टू हर्ट्स एंड रिजेक्शंस, quarrels, disharmonies, very common nowadays. Nuclear families, difference of opinions, joint families, jobs and families. So there is a lot of disputes within the families. Very important remedy, natram. Maintain one-to-one relationship. Why? Because the other one, the third person is not a trustful one. They can breach the continuity of this. So every time we have the issues of third person, when the third person is involved, right? In breach the continuity of one-to-one is also a natram, right? So one-to-one relationship, aversion to questions, pity, sympathy, people consolidating, cares and touch. This is up to psychosis or psychosyphilitic. In syphilis, all the affection get lost. You may find all the this all hurts and all expression of loves and consolation can be gone. Person can be in a syphilitic mode like love perversity, homosexuality, right? Love their own sex. So this is the syphilitic expressions of natram mute. So it is there in nymphomanias. We find how it is possible, right? I think one movie is there. मुझे love नहीं मिला है तो I show you how the love is by destroying the self. We have the rubric, right? Marriage with the old man or
love with the tall man.
Love with this. So this is the distorted love, right? Person destroy their life because they looking that this is a trustful person. Whatever the categories or social terms, whatever, this person is for me, right? While in social context, this person is not for her. उसको लगता है कि मेरे लिए यही है. So this is the syphilitic love, the expression of distortion at affection level, natram mute. You find natram mute in these rubrics. Commonly coming with this magnesiums. Sir, natram लग रहा है कि magnesium लग रहा है? Commonly we encountered at the end point in differentiation. Sir, natram है कि magnesium? Natram है कि magnesium? So both have these oversensitivity, that quarrels and harmonies and family issues, relationship. So as a reaction, natram becomes brooder. उसको वो याद रहेगा, वो ख्याल में ही रहेगा, वो याद ही रखेगी. Because they want to cultivate that trust, right? While magnesium भूल जाएगा, चलो ठीक है जान दो, silent. So the pathological expressions of natrum as well as magnesium is also different. It looks identical but it differs. Here they just want to immediately, they just cut off, they just withdraw, they just go into the silence, right? तो पैथोलॉजी भी उस तरीके से आएगा। मैग्नीशियम सब भूल के उसको अटैच होना है, राइट? नेट्रम डिटैच होती जाती रहती है, मैग्नीशियम अटैच होती जाती रहती है। हाउ इट इज? बिकॉज see, they suppress their emotion at conscious level, right? And they repress their emotion even to the subconscious level, right? Suppression at conscious level कि मुझे नहीं बताना है, मुझे अपने अंदर ही रखना है, because it hurts me more. So that makes the people more self-centered, more selfish, more necrotic, right? और मैं ज़्यादा involved relationship में आगे रहूँगी तो I get more hurts. So they want to detach and detach and detach and detach at subconscious level. While magnesium, we find that these are very orphan child, right? उसको love पहले से ही नहीं मिला है, right? They are born syphilitic sometimes because magnesium is there in the DNA synthesis. So it is deep into the core. They are very into the depth level. Magnesium. So from initial phases they cannot get the love. वो पूरा वैकेंट है, इसको मिला है लेकिन दे आर ब्रिच्ड, सो अप टू साइकोटिक और साइकोसिफिलिटिक लेवल उसको मिला ही नहीं है, तो वो लव सब में देखेंगे। आई वांट टू अटैच द गॉड, आई वांट टू अटैच द टीचर, आई वांट टू अटैच एवरीबडी वेयर आई गेट एवरीथिंग टू गेट द सर्वाइवल, क्योंकि ये सर्वाइवल पर चीज आ गई, राइट? सिफिलिटी। सो नहीं मिलेगा तो जस्ट जान दो, दूसरा ले लो, just go to other level, just go to other relationship. Natrum will not go because of that sensitivity part, right? And there is a lot of discontent also, lot of discontent. Magnesium is not there much in the discontent, in spite they are contented, right? We discussed very first slide of opium where we discussed magnesium makes self contented with himself, right? बिकॉज नहीं मिला तो चलो ठीक है, और दूसरा मिलेगा, बेटर मिलेगा, राइट? उसको ये सेंसिटिविटी नहीं है बिकॉज ऑफ दिस ऑल डिसेप्शंस एंड डिसअपॉइंटमेंट एंड ट्रस्ट इश्यूज. मैग्नीशियम वांट एनी हाउ द पीस, द बैलेंस. सो दिस एक्सप्रेस्ड एज अ सबकॉन्शियस लेवल, प्रैक्टिकली हाउ इट इज सीन. तो सर बहुत कुछ हुआ है लाइफ में, अभी सब भूल चुका हूँ. मैग्नीशियम सर बहुत कुछ हुआ है, सब कुछ याद है मेरे को, ईच एंड एवरी पॉइंट फ्रॉम टॉम टू वॉम सब कुछ याद है मेरे को. जब टाइम आएगा तब मैं बोलूंगा. सो इट इज अ बर्स्ट आउट. सो दिस एक्सप्रेशन इज सप्रेशन, राइट? सो वी हैव मेनी ड्रीम्स इन मैग्नीशियम which is expressed as the subconscious level. A dreams of connectivity, a dreams of marriage, a dreams of dissolving the relationship, a dreams of family, a dreams of missing the dead one, talking with dead one. So this is the expression of emotion at subconscious level. So this looks magnesium contented, silent, happy go. They can never be angry. Here, because of discontent, they looks angry, they are discontented, they are sensitive. So maintain one-to-one relationship, maintain all relationship. This is a clear-cut difference, right? पूछने का how it is relationship, फिर क्या करते हो, what is the attachment, किसको बात बताते हो, क्या बताते हो, कितना बताते हो, how trust you people, what about the new relationship, what about the old relationship, how you see the old and new relationship at certain level. So you get the idea of magnesium and natrum or any minerals at any level. Because we have nowadays a relationship issues, right? We have the family issues and the pathology is also like that, right? When we have issues of bonding, central axis, when we have the issues of connectivity issues, we have the issues of blood have a lot of connectivity, the connectivity issue, the cartilages, the bones also make the prescription of these minerals. Clear? I think clear. So lot of dissatisfaction inside. मेरे साथ क्यों हुआ, रोती बला क्यों हुआ, क्या हुआ. Here they are just moving out, they just move on. सर भूल जाने का क्या है, होता रहता है लाइफ में, right? Happy go type, more of no anger, no discontent. So these attributes of discontent and all looking into the self is more of self-centered. So more destructions and necrosis. So more the necrotic, more the destruction, lysis part is natrum, more of selfless. कुछ देना है, मेरे relations जा रहे हैं, मेरी connectivity टूट रही है, right? So then that case is I am destroying myself, autoimmune identity crisis and genetic mutations, more of magnesium. So they are more deeper into it, right? Sour substance that makes the natrum attributes, they are very inert substance, right? In magnesium, I discussed the photophosphorylation. They gives the life. So all the greenery is because of magnesium. So they are very soothing. They are very important inert substance for the life cycle. Go deeper into the DNA as well as RNA synthesis. That's why we have genetic mutations, because the affinity is like that. Maxelf is dressing applied for soothing. Maxelf is applied for edema and all. So they have a soothing experience. So this is the difference. How you remember. Angry, so more spasms and contractions. They have angers, right? Sir, जरे पण जब भी सर्दी आती है, I got whatever spasms, कुछ भी खींच जाता है. आलस नहीं खाई सकूँ से. आलस खाओ એટલે बेड पर पड़ी जाओ. So they have a dynamic spasms, and immediately they land in the strains and spasms, right? Lumbar spondylosis, back खींच जाती है. Touch you, right? Because they have inner angers, right? Here the peaceful, silent, placid, so more of relaxation and paralysis. Remember, this is holding on and this is giving up. So more the holding on in life is natrum, more giving is magnesium. Remember, clear-cut differentiation at many level. You can enter into it and prescribe the right mineral, right salt at right time. Great emaciations, throats and necks of children emaciate rapidly. In pathological prescription or on observation, you can find in cases of protein, energy malnutrition, marasmus, cancer, whatever. The emaciations start at this. The pride, the necklace, right? Because they are losing the pride, they have esteem remedies. When you have the emaciation of leg, means they are losing the pride. They have esteem issues and they have emaciation. Children, so mother perception could be like this. Elements from pride or wounded honor could be anything. Natrum is there. Because emaciation is because of this. Throat and neck, children emaciated rapidly, sanicular. Almost specific for many headaches, especially migrainous type. It could be a school-going children headache. It could be most commonly ladies we find. It could be a hormonal tension headache, whatever, cluster headache. Because they have psychosomatic issues. They are always sensitive. They have always a X. If person is not speaking up, still they are feeling that somebody is constantly nagging, somebody is reproaching, somebody is reprimanding. Everywhere natrum is there. So they have always an intellectual devaluation. Brain migraine has intellectual devaluation conflicts, right? They cannot understand what I am trying to say. Anger, indignation, natrum, right? Sad, weeping disposition, tongue map, heart pulsation shakes the body, hair fall, touch nursing. These all classical, many clinical cases you find. You just observe and prescribe. Sometimes we find the ringworm on the tongue, map tongue, right? Sir, पहले से ही ऐसा है. You can prescribe. You can. Many remedies we have. Murk. Again in the axis, dull, hot, thirsty. Sir has mentioned with the sideline of these all dull, hot, thirsty remedies. Murk. The trait is defined. We all know that they are defined. They never bending attitudes. So many expressions of defines. You have to study the single words in different expressions at cellular level, at emotional level, at genetic level. You can find many versions or many rubrics. where murk is there. Rebel against politics are as many cases. That is also a type of defiance. Aversion to mother's milk, defiance. Right? Office for honors, defiance. Acute, disobedient, excessive thrust and salivations. Right? Disobedient. दवाई नहीं पीना है, खाना नहीं है, कुछ भी नहीं करना है, स्कूल नहीं जाना है. They are just not obey because they are not bending at all. दवाई पिलाने के लिए बहुत पकड़ना पड़ता है. Mark. So they have increased these things, secretions, constantly moving, restless, rough, revolting against the whatever told. He has disobeyed the mother's command. You have to listen 3 to 4 lines in very acute phase where you want to prescribe mercury, right? Precocious, intelligent, but not at all studious, right? They are intelligent, they have quick, sharp brains, but they have not that diligence, right? It's a sharp brain which make them, they look studious, right? Last end पे पढ़ने वाले, 1 month they are trying because they are very quick, they are very sharp, so that makes the precocity, right? Precocity you use at the graying of hair, this is also precocity, right? वो बड़े बुजुर्ग बोलते हैं कि भाई ऐसे ही बाल सफेद नहीं हुए हैं, काफी दिवाली देखी. So why now these children are at the age of 15 to 20, they got the grey hair. What is the reason to be precocious? We have to find out, to convert grey hair into black. ये बच्चा आगे क्यों देख रहा है? 20 साल की उम्र वाला बच्चा 40 साल का क्यों दिख रहा है? One of the remedies, murk, right? Sulfur is also there. Precocity, tarantula is also there. Sulfur क्या क्या रहेगा? What sulfur can we think of? Precocity. मुझे सब आता है. I taken granted that I know everything. Sulfur का है, right? तो उसका genetic expression वही रहेगा कि भाई मुझे सब आता है. I know everything. Knowledge. Right? Lycopodium is there in grey hair, natrum is there, tarantula is there in grey. So every reason to be precocious we have to find out. This is a perception. कि भाई ये बच्चे को या ये बॉडी को precocity लाने की जरूरत क्यों हुई? Platina, I know everything. I am powerful, right? So I am much the knowledgeable, or I am much the older than what I supposed to be. राइट मैं सब कुछ जानती हूँ लेकिन आता कुछ नहीं है. सल्फर, प्लेटिना को आता है, राइट? सो दैट मेक्स देम, सो दिस कुड बी ए एक्सप्रेशन मेनी टाइम्स फाउंड इन द प्रिकोसिटी. व्हाई यू नीड टू बी प्रिकॉशियस, वी हैव टू फाइंड आउट. इन द ग्रे हेयर, मेनी लेडीज हैव ग्रे हेयर, राइट? नेट्रम का पता रहेगा प्रिकॉशियस. व्हाई नेट्रम इज प्रिकॉशियस? बहुत ग्रे हेयर में एवरी टेम्पल हेयर लॉस, वर्टेक्स हेयर लॉस, मेल पैटर्न, फीमेल पैटर्न, एवरीवेयर नेट्रम इज देयर. तो whatever the expression at precocity level, right? Precocity is expression, but why person is precocity? तो वो कहाँ से आएगा? उसकी sensitivity, उसका genetic से आएगा. Netrums are sensitive, right? Netrums are sensitive to hurts, right? Netrums are sensitive to discords and all communications. So somebody will not breach my trust or my affection in future. So I need to be more agile. I need to be more cover up, right? In future. So precocity is futuristic. Why the person need to be in the future? Why person need to be a futuristic? Because of these people have, this natrum have disappointment, daily quarrels at home, right? So to cover up this, I need to be very agile. There should be no next quarrel. There should be no next hurt. So for this cover up, they remain in future. कि भाई अगली बार ये ना हो, अगली बार ये ताना ना मार दे, अगली बार मुझे हर्ट ना कर दे. So that makes them more precautious, right? Obeys, active, anarchist, revolutionary, right? Those who change the orders, completely revolutionize the system. They are against the system, right? बोलते हैं सर एलोपैथी से कुछ नहीं होता, सर सर्जरी से कुछ नहीं होता, you can do something or otherwise I can make something. तू साइंस में क्या करेगा? साइंस का तेरे को पता नहीं है, right? So they are very, even they go into the depth also. They have quick brains and a very fast speed. They just go to the Google, just note everything and present to yourself. And they try to change the system. They try to change the society, right? Hari has chaotic पता है? Chaotic is a combination of strong will, confusion and restlessness. Like जैसे क्रिकेट में 2 रन आउट में मिक्सअप होते, दिस इज chaos. मुझे इस एंड पे जाना है कि उस एंड पे जाना है. जो chaos रहता है वो सामने वाले को भी chaos कर देगा. So they are in hurries, means their restlessness, they are confused, yet there is a strong will to going that, but this is a wrong way. So it is a combination of strong will, confusion and acute confusion and restlessness makes the chaotic. इधर उधर घूमता रहता है, पता नहीं सर क्या करता है, बस इधर उधर बस पूरा दिन यही रहता है इसका, right? So you must remember the R for murk, restlessness, rough in behavior and revolting. क्लिनिक पे थूक देंगे, so this is not the modesty, this is a rudeness. फादर को मार देंगे, मदर को नहीं मारेंगे, because mother is the weakest part. They just rebel the strongest part because they are revolutionary. They think that they have a lot of strength, and actually they have. So they beat the father, Mercury. Okay. Anything which is against the established order, despite of adversity, could be anything. Self, system, life is fighting. When the life is fighting, like कोई immunomodulator કે કોઈ severe injections આપવા પછી means એવા molecules જે life ને completely destroy કરી નાખે છે, severe weakness આવી જાય, severe vomiting ચાલુ થઈ જાય, these people have done. Despite of so much of toxicity, despite so much of cellular disharmony, despite so much of destruction, they are fighting because they have a strong will, right? So આપણને બીક લાગે કે ભાઈ there are some injections or there are some protocols has to be given in hospitals. सर इधर ही कर दो ना, मेरे को कुछ नहीं होता, मैं कभी कभार 2 से 3 पेन किलर एक साथ में खा लेता हूँ, कुछ नहीं होता. 2-3 पेन किलर खाने के बाद भी मेरे को गैस्ट्राइटिस नहीं होती है. Actually they don't have. While normal people have gastritis with single tab, right? Because the tolerance power of these people is very high. That makes the mercury defiance. So this could be also a trait. This could be also a reaction of mercury, right? Sir, कुछ नहीं होगा, दे दो. Because they are fighting and fighting and fighting and fighting, right? So against anything established order, they are always in disorder. Remember, एक पैथोलॉजी के बाद दूसरी पैथोलॉजी, दूसरी के बाद तीसरी, every is destroying. Every next pathology is destroying the life. Still they are fighting. Still they are fighting is murk, right? Despite of adversity, means how much you inject, how much you suppress these people, because they are never bending. That makes the people mercury. So we have many rubrics of this defiance, like obstinacy, defiance, contrary, anarchist, revolutionary, injustice cannot support, contradiction, intolerance of, rebel against politics, Unstable in stable, stable in unstable, this is also murk. Because you cannot catch the murk. वो mercury को आप catch नहीं कर सकते. Still they are bind also. They are binding in their molecules. Despite they are highly stable. So once you have a reaction like that, stable and unstable, stability and instability, this is also chaotic part of murk. It could be at any level, wheel level, it could be a cellular level, genetic level, whatever. You can describe murk. Disobedience expresses an injustice. They're just moving from the injustice. Every time they think that this is not the right thing for me, it is they just fight out with the whole society, right? Contrary, defiance, disgust, iode element can be studious. So sir has put murk iode and murk iode rubber and flavors in the diligent consensus mercury, where some element of iode is there with glandular element, hunger element. You can prescribe murk iode flavors and murk iode rubbers. This is a disposition, angry, hot, fast, syphilitic, right-sided, defined destructions. You have a history in the past, ulcer, dysentery, salivation, suppuration. You can confirm this is a murk. Because they are born syphilitic, right? From syphilitic mother, right? Because mother has passed syphilis, that's why these are born syphilitic, so express syphilis at very early age. Very early age. Ulcers which is non-healing, dysentery which is non-healing, lot of boils and abscess which is not healing, right? Congenital deafness, congenital cataracts, these are all born syphilitic. You can think of murk. Sharp, strong feature, fighter look and justice. You just think कभी कभार अकेला आएगा, बच्चा है अकेला आएगा without parents, पूछते क्यों कहाँ है, सर दवाई दे दो. Completely independent, very strong, मदर घर पे है, पप्पा बिजनेस पे है, मैं दवाई लेना है. So that makes them very strong feature, very positive kind of fighter looks, defined character, strong looking. You can think of sharp feature, very prominent face, murk. Syphilitic face. Syphilitic face is also murk, syphilitic, where there is a contour and all the expressions, where the life is not there. The normalcy is not there, the balance is not there, completely distorted. You can think of murk. Right? Instability at what? Self-control, difficult to maintain, free secretions, sensitive to heat and cold at night, glandular affection, lying on the right side. So कुछ instability है ही नहीं, पूरा out of control. Could be anything, secretion, it could be a heat or cold, temperature regulation, it could be a fever, it could be any pain which is totally unstable. Human barometers, that's why we have mercury in these things. We are very sensitive to extremes, right? Glandular affection of syphilitic kind. Many manifestation of hereditary syphilis, total destructions, manifestation of hereditary syphilis, many supercausal. Now we are moving into the mind of pathologies where murk is prescribed, where mother passing or generation passing syphilis to the next generation. When you cut short, when you come to the perception of mercury, you just cut short that syphilitic attribute to the next generation. So this is possible with this salt, right? Because it has its own depth of action, because it produces syphilis, right? In depth. So it is there in, I think, Allen's manifestation of hereditary syphilis, total destruction, generation to generation. Eccentric, we have unpredictable symptoms of mind and body. You cannot predict the next move of these people because their moral is not there, right? The emotions are not there. They have a strong drive to their self. So next follow-up में वो क्या present करेंगे, क्या देंगे, you cannot predict, right? So they are always unpredictable. Trembling, disordered or paralyzed part, so it is one of the very important remedy for Parkinson disease or neurodegenerative disorders, where there is a lot of atrophy of brain, lot of degenerations of brain, destructions of brain, syphilitic attributes, you can think of murk. From the trembling or some chorea or athetosis or asthenia, you can find out where is the balance. Instability, stability वाली बात हुई ना? Where is the balance is going? Because they want to control the things, right? Suppose for old age, we have this disease in the later age, right? Parkinson's, myasthenia, neurodegenerative disorders, where the person losing the control. આખી લાઈફ એને કંટ્રોલ કરી હોય, સોસાયટી, પ્રમુખ, ફેમિલી ના બચ્ચાઓ, બધી વસ્તુ કંટ્રોલ કરી હોય. When some other murk or some child is mercury, if the child is mercury, so they control their father. If the father is also mercury, then they control the loss. They lost the control. Example, right? If the child is also dominating or the son is also dominating, want to control, कि सर अभी फादर छोड़ना ही नहीं चाहते, सब कुछ इतनी एज हो गई है, समझा रहे हैं कि भाई अभी छोड़ दो, अभी जरूरत नहीं है. Why you want to control all the things, right? Both the sons are explaining. Father is not moving. कि control तो मेरे हाथ में ही रहना चाहिए. It should be in my control always. It could be anything. Social dictums, it could be society norms, it could be it could be the family decision, could be anything. When the son is trying to control the father, these people end up in Parkinson, myasthenia gravis, whatever, cerebellar degeneration, because they feel that I am losing my control. Because this control or the power or the position is my life, right? So many times we find these types of situations and perception where control is the very important things, right? फिर उस कंट्रोल में उसका इमोशंस, उसका जो भी एस्टीम है, the will, drive to control the life, सब कुछ दिखेगा. But the perception is this: they want to control. They cannot obey the things. Uncontrollable desire to travel, TUB जैसा है ये भी, because their inner impulse is there. TUB want to change. कि भाई आज यूरोप देखा है, अगले साल हम यूएस जाएंगे. They want to change. Every change means they want to taste everything, different colors. Makes TUB. Here there is an impulse, inner urge to satisfy, inner urge to run. सर जाते हैं, मजा लेते हैं, 15 दिन मजा आता, फिर चले आते, बस ऐसे ही गए फैमिली के साथ घूमे. Because their inner urge, inner impulse, these people are very restless, very impulsive. वो inner urge to satisfy, to get makes them the word is there for these people. Metropolitan, uncontrollable desire to travel, indifference to everything, does foolish mischief behavior, disgusting actions. At the end they just cut off. They don't want to obey the things. So disobedience runs behind this indifference. Indifference है लेकिन मैं बात नहीं करूँगा उससे. I don't to move. मैं बैंड नहीं हूँ. So continuous disgust as well as disobedience runs in the mud. That makes them indifference. Falling of hair from sides and temple, right? Very important. Temple, the early male pattern baldness, very important site. And you have to go to the perceptions also. Why this temple is going? Why the vertex is going? Why the forehead is going? Why the hole is going? Very important. In alopecia cases, black spot, flame spark before the eyes, very important, syphilitic, especially in foundry men. Typical occupational hazards is there, and when person is sensitive to this spark, murk is the only remedy, maintaining cause. But person is sensitive, that's why they are affecting. So we have to strengthen the constitution. Don't want to remove the job, because this is a survival. Menses, we can think of female cases where a lot of beautiful symptoms are given in murk, never applied. Even I also not applied cases. They are collapse and faint at start of menses. like veratrum, alumina, ovisa. They are fainted menses. So they are very severe PMS, painful menses, full of milk at menses. So they have lactational issues also. Abscess appear everywhere on the body during menses, disappear after menses. So they have suppurative process with the menses. Milk in the breast of boys and girls instead of menses. Leukorrhea in small girl causing prostration. Very tragic symptoms. Sterility with 2 profuse menses, only remedy. I think phosphorus is also there. Sterility with 2 profuse menses. There are a lot of injection given despite the menses is continuous. In cases of sterility, you can think of Merck as a concomitant, right? Almost specific for all kind of dysentery. We know that Merck, right? So some are very important concomitant in menses. Merck is indicated. Now different sort of Merck, we know that when Merck, constitution like Merck, with the affinity of gland means love, like left side means motherly love, deep syphilitic case, Merck-like case, you can think of Merck iod tuber. Merck iod flavors, again iod element. Deep syphilitic case, right sided, Merck iod flavors. Merck core, fast destructive breeder. Corrosion, it's a very corrosive, Merck core, the word is corrosion itself, Khawan, acid like. So there is a lot of fast destruction. Syphilitic cases you can think of. Cinnaberis, red fiery, more spiritual and go-to. Mercury. So this is a different kind of Merck. When Merck-like constitution and spiritual attributes, you can think of Cinnaberis. Like I think Sindur, na? Cinnaberis is here. The focus, right? Inner focus. जे આપણે meditation માં કરીએ. So just remember Sindur as a spiritual Merck, right? Spiritual Merck. Because they are just get rid out of all the society and they just go into self-development. Merck sulf, edema of lung, hydrochlorics, almost specific, history of GE and feature of sulfur. Almost sulfur as a this thing. Merck sulf. Now some of the very important vegetable I have differentiated in the Merck called as vegetable mercury, right? Azafoetida, Asarum, Phytoleca, Podophyllum, Sarsaparilla, Mesothelium, Cicuta, Ranunculus bulbosus. These are the vegetable have mercury-like effects. So these are very syphilitic vegetables. Asarums, they are hysterical. Azafoetida is also hysterical. Phytoleca has glandular. Podophyllum has more of GIT. Sarsaparilla more of has female genital. Urogenital. Mesothelium has the skin. Cicuta has the brain. And Ranunculus bulbosus has nerve affinity, skin affinity, with mercury-like effects. You can think of. So next time we just start with Kali Sal. Dr. Jitesh will discuss some very important clinical point of ophidias, which is remained rare ophidia. Of course, not rare, but he has applied these ophidias in clinical practice. Some very important inputs from Dr. Jitesh. We welcome Dr. Jitesh.
આમાં મોકલાવું તને
એને લેપટોપમાં દેખાડો
ફોનમાં છે તો આમાં ડિસ્પ્લે ફોન આમાં જોઈન કરવાનો
કનેક્ટ
તો તને મોકલાવું. Good afternoon.
Good afternoon.
Today we will learn 3 ophidias, rare ophidias, which are not usually prescribed and not well proved, but clinically useful. And I have experienced this ophidia in my practice. In such clinical condition, 3 ophidias are like Toxicopis pungex, another black mamba, and Bungaris fasciatus. Now we will learn the one by one of these 3 ophidias. First of all, this is a moccasin, water snake, લાઈક અ શેંક્રીસ અને ગામમાં એને ધામણ કહે, ડેંડવા કહે, ડેંડવા એન્ડ ધામણ યુઝ્યુઅલી lives in the wall. કૂવામાં જનરલી જોવા મળતા હોય, તળાવમાં ને એમાં જોવા મળતા હોય, અને they are especially, this is a habitat, this is a Indian, they are habitat in the water, that's why it is a water snake. And the main usually survival of these things is a frog, lizard, rat and fish. If you find this in the river or any this area, they will eat fish. So there are many patients who loves fish more. Fish eater. The main food of this snake is a fish and frog. So we will see there are certain animal eaters people, non-vegetarian or fish eater. That is the first thing of the pongax. And what is the peculiarity? If this snake bites, then the first year that swelling, pain and fever, these three things will occur, and subsequently year by year, whole year will be remission, and the same annual periodicity it will come. Edema, fever, pain. Then next year intensity will decrease, and since last many years this will comes together. So you will find the edema, neuralgia and fever, annual periodicity. Think of the toxicophics. I will say the toxicophics is our Cedronophilia. Cedronophilia. And another things, this ophidia is many ophidia is a hemotoxicity, neurotoxicity, cardiotoxicity, vascular toxicity, lymphotoxicity, and this ophidia has a toxicity at the level of the genes and chromosome. So it is our genetic and chromosomal toxic ophidia. Which genes? Especially of the sex chromosome genes. नीचे 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 ऊपर 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 પેલા ઉપરનો નીચેનો નીચે કરી દે, પછી છેલ્લે લઈએ નહીં, સ્ક્રોલ ડાઉન આમ ઉપર કરી દે, પેલા આપણે જવા દે. So clinical edema and periodical neuralgia, you can see in the clerk, toxicopis pungax, clinical edema and periodical neuralgia. Peculiar feature of the cases where symptoms pain, fever recurrent annually, exact at the same period, many years with the decreased intensity each year. This is exact words of our source book, and clinically you will observe in such pattern. Think of this ophidia, and especially when chromosome genetic, especially of the sex chromosome. Why this happens? When this ophidia bites, it will hamper your genetic material, especially of the gonads, especially of the sex chromosome X and Y, and that will delete the part of this whole chromosome. So whenever you will find in a chromosome study Y is missing, then that is known as a Turner syndrome. Turner syndrome is a syndrome when clinically web neck, short statures and defect, heart defect, ovarian failure, agenesis of the corpus callosum, heart deformity, cystic hygroma. At that time in fetal anomaly you will see, and before prior that you can also see by the amniocentesis and chorionic villi sample. That is a triple marker test. You can detect if the child will born with the such kind of the deformity, that is a genetic. But after birth you will see the clinically short neck, web neck and heart defect or any kind of this clinically presentation, ovarian failure, agenesis and death. Now why this happen? This ophidia is specially known as a facultative parthenogenesis. This child is born with the no need of the Y. So why no need of the Y? X and Y is the sex chromosome, and that detect either you are male or female. So in this ophidia, especially there are the 5 to 6 people on the earth. They have born the child without fertilization. Kunti, Suryaputra. What was happening at the genetic level in the Kunti? The Kunti, there was no need of the wife. Partho and genesis. Partho means production and genesis, development. So here I need to born a child. So in this world, anyone who need to born a child, they need the X, Y, and this material come at the development of the fertilization. The fertilization occur without of the Y, only X is sufficient, Y is no needed, and even though they born the child, that is known as a facultative parthogenesis. Facultative parthogenesis. Facultative parthogenesis means facultative is a virgin. They can remain a virgin and they can give a birth. This is a virgin with genesis of a child. That's the virgin with creation. That is known as a facultative parthogenesis. And this ophidia has an affinity at the level of the gonads and chromosome, especially Y is deletion. So it is a known Down syndrome, Mokase, monosomy, Klinefelter syndrome, Turner syndrome, where this particular sex chromosome is affected. Either it is a fully sex chromosome, Y is not there, or either is a partial X chromosome, 46X XP or 46X X cube. At short arm or long arm, certain materials delivered, that is known as a partial, and complete is there is no Y chromosome is there. So this is a moccasin of toxic office. Another ophidia is a black mamba. Now this black mamba is known deadliest poison. Once black mamba bite, they will never give a second chance. And difference between the black mamba and toxic office is when this attack is there and open the mouth, there is a cotton wool appearance, white, that is a toxic office. When black mamba has an inside totally black, like a hypermelanosis lichen planus. When you see the oral lichen planus, think of the black mamba. Black mamba fast and furious. You everywhere. His speed is a fast. Dreams of fast. Loves fast. Everything is fast. Fast, speed, and flying ophidia. They can fly from the dreams of flying. Leptoductus mactus, leccan, asaram. There are so many dreams of flying. Black mamba. Unfeeling, hard-hearted. And one peculiar thing is black is a black. Light and black. Light is light, black is no light. When there is a sadness, depression, hopelessness, black clouds settle around, black depression, as if going into the tunnel, no hope, hopeless, despair, useless, worthless, forsaken, alone, deserted. These all are the estranged, helpless, black mamba. So I can say black depression. Try to understand the word black depression and speed and flying and deadliest poison, black mamba. Delusion tormented, China, aquamarina, lysine and black mamba. Tormented. Delusion, another peculiar at the genetic level, black mamba, there is a delusion, he has a two set of the penis. Absence of penis is a cocaine. Absence of penis and two set of the penis, black mamba. Third opinion. Bungaris fasciatus. I will say this ophidia is a purely neurotoxic. It attacks on the nervous system, especially amyotrophic lateral sclerosis, anterior one and posterior one. Disease you can say when needed of the IVIG, GPS, spinal muscular paralysis, slow progressing paralysis, poliomyelitis, These all are the, and this is a energetic, embrace, bold, audacious, and nervous system ophidia, pungaris. And all the vaccine anti-serum is prepared from the crate, and this bungaris. Bungaris is a crate like a elapse. And the anti-venom, you can see anti-venom. Anti-venom.
Venom. Venom.
Venom.
Plus venom.
Anti-venom. Joy. How to make crotalin. Elapid crotalin. Joy. Anti-venom, North American coral snake anti-venom, and it is prepared. Cobra, crate, Russell's viper, એ બધામાં વપરાય, પણ that is a prepared form. And this is a edible snake. Edible એટલે ખાધેબલ. Previously, people were used their gallbladder and mercetide with the wine, and they used to drink, and they suffer from the central nervous system, anterior one, posterior one, and amyotrophy, lateral sclerosis, in form of the clinical presentation. And what exactly happens in our potent eyes we give, it will reverse. Okay, thank you.